preparation that went into this, so thank you, John, for all the legwork that went into there's a lot of moving pieces within LEAP. Wanted to, part of my welcome is to talk about our agenda today. We have a couple of presentations. Dr. Leslie Milne will be talking to us about emergency safety and medical stuff, as only a doctor can do. And then we'll have Peter Tibbetts talk to us about electrical stuff, as only an electrician can do. And then the health department is here today as well. We've got potassium iodide distribution as part of the program today. And Sunny Robinson will spend a few minutes at the end kind of explaining a little of that, and then we invite you to catch up with her afterwards, and also catch up with your neighbors and grab another cookie or brownie and a cup of coffee as we go. Very informal day. Get up, grab some coffee, grab a cookie as you go. I intend to. Want to recognize our counselor, Jackie Hardy, who is with us once again today. Thank you, Jackie. We appreciate all you do for us. And Jackie shows up. That's what's great. She shows up at all our events, so that is terrific. I want to spend just a couple of minutes talking about LEAP because we have a few folks that may not be completely familiar with what we do. I think in general I'm preaching to the choir, but let me just bring a few more of you in. We do have a table up back with some information about LEAP and a sign-up sheet so we can grab your email address, mostly your email address, because that's how we communicate largely for events and different things going on. There's also a table up back for the community center, without whom there's no roof over our head here. So, and there's some information and sign up there. If you are not already a member of the Lanesville Community Center, we hope you will indeed consider that and become part of that. That's important that we're all here and doing this together. LEAP was formed about 18 months ago when the roads leading out of Lanesville toward Rockport were flooded, just like they are today. Sandy Burton was here earlier and mentioned that the ducks are drowning in the middle of the streets. But we had the Mother's Day storms, and the city, I think what we found out of that event was that the city was really overwhelmed in terms of response. And we had some issues here in Lanesville, but clearly they weren't the priorities for the city at large. But if we're sitting here in Lanesville, it's a priority for us. And so that's what spawned the, hey, maybe we ought to be a little more self-sufficient down at this end of the island. And so a lot of LEAP events have happened. Coming out of that, there's been an awful lot of education. The city's been here a couple of times talking about pandemic, talking about Lyme and tick disease, getting us a little smarter about how to get into the woods and not come away sick, as some folks have done over the past couple of years. LEAP has also, though, had been many hands over the years. We have, here at the community center now, we have a brand new generator that the community center has purchased, but Peter Tibbetts has done most of the work in terms of getting the panel there, and it's a lot more than just buying a generator. It's got to hook into something and actually run the lights, and so Peter's done all that work. Peter and Sandy have worked hard at getting an FM transmitter on the roof. And we have, for emergency broadcasts, we have the LEAP station, which is 88.7 FM. So if we do have some emergencies, we expect to be able to broadcast on that frequency. It's got about 1.5 mile range, which is, I think, all we're allowed by law to have for that. So that's in place. What else have we done? We've done a lot of things. I'm just going to highlight a few. We do have a website, which is leap-lanesville.org. And we're trying to be more fastidious about keeping that up to date, but we have basic contact information out there now, and hoping to get that going a little bit more. And we've got some emergency supplies here. I'm not going to steal Leslie's thunder; she could talk about that a little bit. But the other piece is, back in December, the last program that LEAP put together was a disaster simulation, which involved actually some demonstration and some lessons about hooking up the generator, because what we have learned through LEAP is that if something happens here, it'll be up to the subset of us that are actually here on the island at that moment, because a lot of us are commuting, away on business, away on vacation, whatever it might be. So if something happens, the neighbors that remain are the ones that will have to kick in. And so we had a little bit of a test around that. We meet generally once a month, and if you're on our email list, we'll make sure you get invited and can participate. And this is about neighbors helping neighbors. So the more hands we have, the better off we are. So with that, let me introduce Dr. Milne. She is obviously a doctor. That's the Dr. Milne at Mass General, and has been one of the real key members early on for LEAP. She's also one of the directors of the community center, so involved in both. And I forgot to mention, because she is the leader of this, 4th of July, Leslie's leading the charge to do some more family events. We can do some fundraising to actually get an emergency whistle put on the building here. That's part of what we're hoping to do. But there are a lot of family events. The first organizational meeting around that is here at 7:30 on Tuesday night, this coming Tuesday. There's some sign-ups up back, but I hope you can participate in that as well. That'll be an awful lot of fun. That's all yours. Thanks.
Thank you. Good afternoon. Thank you for coming. Hopefully you'll get some information out of this. I work at Mass General in Boston and live here in Lanesville. My goal today is to do some basic first aid stuff, some things that are true emergencies, and some things that hopefully you can manage in your home so that you're not forced with deciding, should I go to the emergency room, should I stay home? So it's things that I come across in the emergency room that are questions people often ask me. A couple basic things that I hope you can take away from this is use your common sense. If you think somebody's sick, they probably are, and you need to get some help. Okay? If you wait too long to make that decision, you could be in trouble. So as a physician, I would much rather have you bring somebody in with chest pain and me say it's indigestion than for you to sit at home with somebody that's having a heart attack. Okay? So don't be afraid to bother the doctor. That's what we're there for. Okay? And I hear a lot of people say, I didn't want to bother the doctor, I didn't want to call 911 and cause a big ruckus. Okay? Don't worry about it. Okay? It's much better that you cause the big ruckus than that you miss an opportunity to really help somebody that you can save early. Okay, so those are my two main things, and if you left right now, I'm happy with you understanding that. So a couple things we've also tried to emphasize through LEAP is the term called ICE. And ICE means in case of emergency. And pre-hospital responders, the ambulance people, the paramedics, the firefighters, the police officers, they're trained to look at your cell phone and look up under I, and that's the number that they would contact to get a family member or whoever your contact person is. So if you're lying there on the ground, they will know to look at your cell phone and they'll know who to call. So it's a simple thing. It's just like putting Ted or John in your phone. It's called ICE. So we'd really encourage you to do that. If you don't have a 5-year-old to help you, they can probably do it faster than you can. We can probably help you in the back of the room. Anyone back there? Beth, maybe Chris can help you with your cell phone. Okay?
Listen, remind they don't have to put those dots in there either.
Right. Yeah, you don't have to put the dots. Just ICE. Anything under I, they're going to look for. I'd also encourage you to ice your refrigerator. Same thing in case of emergency. If you're found in your home, they would know to look at your refrigerator. 1, for emergency contacts. 2, I would really encourage you to keep a list of your medications and medical problems and doctors somewhere very close, if not on the refrigerator, in your pocketbook or whatever, because it's very, very helpful to other people if you can't give the story, that there's a piece of paper there that says this is what their problems are. Which phone to use in an emergency? Your cell phone or the house phone. Preferably the house phone if you're in the house, because that can be traced to your location. The cell phone cannot be. Obviously, if you're not at your house, it doesn't matter which phone you're using, but if you have a choice and you're in the house, use the house phone. Okay. This is just if you are under 50 and don't know what that first thing was, a telephone. Okay. So most of you probably have heard about taking your pulse. And somebody that's pretty healthy, if you sat here right now and took your own pulse, you use your fingers, not your thumb, to take your pulse, and you go right down your thumb and you feel your pulse. Somebody who's awake and alert, you can usually feel their pulse. And you should know what your own pulse is, because if you get to the hospital and your heart rate's 100, well, that may be considered normal, but if your normal heart rate is 60, I would then say, wow, there's something new going on. So I'd also encourage you guys to learn how to take your own pulse, and your baseline pulse is what your pulse is when you're lying there in the morning before the alarm goes off and you're awake. Just take it. That's your basic resting heart rate. So I would encourage you to know what your own pulse is. You can get it there. Again, it's just taking your fingers on this side of your hand, and you can just touch down lightly. If you push too hard, you're going to cut off your pulse, and then you're not going to feel it. So just light touch and know where it is. Now, sometimes that's hard to get because it's really far from the heart. That's about as far away from your heart as you can get. So the easier place to get it is on the sides of your neck. These are the two big blood vessels, the red ones there, run down the side of your neck, and those are closer to the heart, and they're a stronger pulse, so you can feel those more easily. Again, it's just a light touch. You don't be squishing your neck. Just put your fingers right on there, and you can feel your pulse. So this is a better place to check the pulse in somebody who's unresponsive. Somebody who's unresponsive is usually unresponsive because their blood pressure is quite low. And so in order to feel their pulse, if you're trying to feel it on their wrist, you may not be able to feel it. If you can feel it here, it usually means they have a blood pressure of at least 60. So go ahead and check it here. If you don't feel a pulse there, then there's probably a problem. So here's just an example of a person actually taking their own pulse. Okay. And what's your pulse? It's the number of times you feel that little beating in a minute. So we usually don't wait a whole minute because no one has that patience. You take it for about 15 seconds, and then you multiply it by 4. So if my pulse was 20 over 15 seconds, I multiply that by 4, it's 80. That's what my pulse rate is. Okay. So normal is 60 to 100. You will find that people that are very athletic will have a slower heartbeat, and people that are on cardiac medications, particularly beta blockers, atenolol, metoprolol, those will have a slower heart rate, and that will be normal for them. Okay, just as a concept, any pulse is better than no pulse. And that's really what you're trying to distinguish. Is there anything there, or there's nothing there, or I'm not sure? Okay? And those are all reasonable decisions to make. You may not know what's there. Okay? So if you're not sure, you can't get a pulse, you're slapping them around, they're really not responding, act. Okay? Don't call your friend and say, I don't know what to do. Do something, okay? Because this is really a time-sensitive issue. So if you know how to do CPR, and I would really encourage you to take CPR at least once, so you at least feel comfortable about where you put your hands, how you do the motions, please do it, okay? There's nothing more frustrating than a family member who comes in feeling guilty because they couldn't do anything because they didn't know what to do, and they feel terrible. If you've ever done CPR, has anyone in this room ever done CPR for real? Scary, right? Okay, you're shaking, particularly the family member. You think it's bad on nobody you know. It's really bad on a family member. So I would encourage you, if you're there and you see something happen and there's a family member there, offer to help, because you're going to be in a much better position to be calm than they are. Have them go call 911 and you do the CPR. But really would encourage you to learn how to do this at least once so that you feel that you can do something. Now, don't worry if you don't save somebody. Even in the best circumstances, in the hospital setting, we only save about 1 in 10 person that has a cardiac arrest. Even they're on the monitors. Okay, so it's not something that's going to work every time. So if it doesn't work, don't say, I did it wrong, I'm a bad person. I congratulate you for even trying. Okay, that's all you can do. So don't feel bad. Now the defibrillator is another story. We have automatic defibrillators now, which are user-friendly. You turn it on and it will tell you what to do. It'll say, place electrodes. So that's what these little guys here are. These are the electrodes. That's a little picture as to where you put it right on their chest. And it'll say, scan clear, and it'll start to evaluate whether the person needs the shock, and it'll tell you, shock or no shock. It tells you to push the button. It's very clear, and you can actually do it if you've never learned how to do it, but you really should go to, they do teach this at CPR classes now, and all public buildings now have these machines in them on the wall, and you can actually take them out and use them. This will make a difference. Okay? These do save lives. All right? So I really encourage you to know how to use those, and it really is quite simple. Okay, so I want to talk a little bit about some of the big bad things, because I get asked this question, I think he had a heart attack. So what's a heart attack? So I'd like to go over a heart attack and a stroke and what the difference is, so everyone's clear about this. This everyone's going to recognize. The 56-year-old guy clutches his chest and drops to the ground. Okay, my dog could know that that's a heart attack. It's very simple. But there's a lot of other things that aren't quite as clear as this in terms of someone who's having a heart attack, particularly in women. Heart attack is still the #1 killer of women and men over 40 in the 50 age group. Okay. So oftentimes people will just come in saying, well, my jaw's a little sore, or I don't have pain, I have discomfort. And that, to me, I don't understand the difference, but they'll say, I have discomfort, I have tightness, I have burning, I have neck pain, my right arm hurts. The classic symptom is, crushing chest pain with radiation down the arm, but there's a whole variety of those things. So if you're not sure, again, come bother me, okay? I want to know that are you having the atypical kind of chest pain, and we can do something before it becomes the drop over dead kind of chest pain, okay? So what the heart does, remember we took the pulses in the wrists and the pulses in the throat. And basically the heart is a big muscle and it pumps blood throughout the whole rest of the body. It goes to your brain, it goes to your little toe, and it also goes back to the heart itself. So the heart pumps blood and it pumps blood back to itself because the muscle of the heart needs blood as well as the rest of the body needs blood. So what happens with a heart attack is that one of these blood vessels, so the heart's pumped the blood out and it's pumping it back to itself through these are the coronary arteries. And what happens is one of these coronary arteries gets blocked off and it causes this gray area is actually damage to the heart muscle. So that's what a heart attack is, a blockage of blood flow to the heart with actually killing a part of the muscle of the heart. And how does it happen? The most common reason, we get talked about cholesterol. You get these plaques built up of cholesterol. They start narrowing. This is a blood vessel to the heart. They start narrowing that flow of the blood to the heart. They rupture. You get this plaque released. And what happens over here is a blood clot forms because the wall has now broken and it bleeds, just like if you cut your arm. You've now cut the blood vessel and it starts to bleed and a clot forms. And that clot and that plaque all of a sudden have completely obstructed that blood vessel so that blood can't get through and get to the muscle wall of the heart. And that's what a heart attack is. Okay, so what can I do about this? If you think someone's having a heart attack, you're having chest pain, okay, have them lie down. The more they exert themselves, the more that muscle has to work. So you don't want them to do any exercise. You don't want them walking up the stairs, trying to run it off. Okay, have them rest. If there's someone that actually takes nitroglycerin, nitroglycerin is a heart medication for people that have something called angina, and it dilates the blood vessels. So if they have nitroglycerin, it usually comes in a little bottle, it's in a little dark bottle, get it for them and help them put it under their tongue. They can take 3 of those, 1 every 5 minutes, and that sometimes helps relieve the pressure in the chest. Call 911. This is not somebody who you want putting in your car and driving to the hospital, okay? Because they can get worse, and you're not going to be in any position driving that car to help them. So this is something you definitely should call 911 for. If they're awake, have them chew an aspirin. An aspirin dissolves clot, or prevents more clot from forming is really what I should say. So that clot that's formed, the aspirin prevents platelets from coming together, which is what a clot is. So the aspirin will prevent those platelets from coming together and forming more clot. So it's aspirin, it's not Tylenol, it's not Motrin, it's actually aspirin. It doesn't have to be Bayer aspirin, any of the generics are fine. Okay? Now feel free to ask questions as we go along here if you have something you're dying to know. So what's a stroke? Okay. A stroke is basically a brain attack. It's the same thing as a heart attack. You've now lost blood flow to the brain. Okay? So here's the heart pumping out its blood, it's going up to the brain, and now all of a sudden there's been an obstruction in that flow up to the brain and you've damaged some brain tissue. Okay? And the same thing, you get a clot or some plaque forming and it completely obstructs one of those blood vessels and then you stop getting blood flow to the brain. There's actually 2 types of stroke, and it's a little bit important to know. There is the kind which is like a heart attack where the blood flow actually stops, and so there's no nutrition going to the brain, and that part of the brain dies. And there's a hemorrhagic stroke. This is where one of the blood vessels actually ruptures and you bleed into the brain, as opposed to now you got too much blood and it's loose in there. This usually causes a headache. This stroke does not cause a headache. Okay? And we'll get into what a stroke looks like. But generally, a plain old stroke of this nature does not cause a headache. A bleeding in the head will cause a headache.
And that's the embolism?
Now, this is an embolism.
That's an embolism.
This way, where there's a couple, I don't want to make it too complicated, but a blood plaque can form in the heart and it can travel. An embolism is something traveling to obstruct the blood vessel, as opposed to a plaque which is right at the site and has been growing over time. So they're a little bit different, but they have the same result. So what does a stroke look like? They're usually weak. They can be any or all or one of these symptoms could be a stroke. So don't say, well, they didn't have this and this, but they had this one, so I'm not going to go until they get these two. Be very overread on these, because for a stroke, you have 4 hours to do something. And that means 4 hours at a stroke center, because if you start having stroke symptoms and they want to take you to a stroke center, Addison Gilbert is not one, so you would have to be transported from Addison Gilbert to one of the downtown hospitals to get the best treatment for a stroke. So if you decide to wait 3 and 4 hours before you even go to the hospital, you're going to be outside the window where we can really offer you some very aggressive therapy. And it's the difference between being a normal life and being on complete care for the rest of your life. So it makes a difference. Yes, sir?
Is MGH a stroke center?
Yes, it is. Okay. So the symptoms, if you're really looking for weakness, clumsiness, like you're trying to pick up your pen and you're like, it just doesn't work. So you're clumsy with your arms or legs. You may have trouble swallowing. It may be speech. All of a sudden they have garbled speech. You're like, or they keep saying the same thing, or they seem very frustrated. They're trying to say something, but they can't quite get it out. These are all symptoms of something happening in the brain that's not normal. And you should recognize it quite quickly. Yes, sir?
Hi. My daughter just sent me an email, and it lists, I think it was 5 different things to recognize a stroke in somebody, and they were very simple kinds of things. Ask them to stick out their tongue, and if they're sticking it out and it's going to one side or something, that could possibly be a stroke. Ask them to smile.
I'm going to go through those in just a second. But I appreciate it's correct. If you're not sure, there's simple things you can do that would help you say, yeah, you don't look quite right, and then you do these little simple tests, and it does help you clarify it. Another thing is dizziness, and people always say they're dizzy, and you're like, what do you mean by dizzy? And to a physician, we're really trying to find out if you have vertigo, and that means true spinning. You're on a merry-go-round, drunken sailor, you can't walk because you're falling. That's true vertigo, as opposed to I'm dizzy, I feel weak when I stand up, and more weak and drained. This is the spinning sensation. That could be a stroke of your cerebellum, which is your balance center. And that will cause a lot of nausea, vomiting kind of symptoms. Again, a severe or unusual headache, that would be more consistent with a bleeding kind of stroke.